Hello again, I'm Dr. Nev and I'm a licensed psychologist. This is part 7 of my 10-part series on depression management. I routinely utilize these strategies with clients in my private practice, and I hope you will find them to be useful as well. If you are experiencing significant distress, please contact your local psychologist. In today's video, we will discuss 3 additional behavioral strategies that can make a positive impact on your symptoms of depression. The first strategy is focused on solutions versus placing blame. So when things go wrong in life, it is so tempting to point the finger the other way, and sometimes even satisfying to place blame on another individual or life in general. And what I would like to challenge you to do is let yourself kind of get through that blaming stage and then quickly focus on the solution. So what can be done about this issue? What can I do? What have I tried to do about it before? What type of assistance do I need and from whom? So for example, it helps to break the problem into manageable chunks. So if, let's say, your dishwasher breaks, you can ask yourself, what can I do to make this better? Maybe I can find somebody to repair it. Maybe I can go online and search for different brands of dishwasher, ask family and friends for recommendations, maybe even go to my local hardware store and find out what the current models look like and whether any of them would meet my needs. So the goal is to have a realistic to-do list and to very quickly focus on solving the problem versus kind of dwelling on why it happened, who did what, who is to blame. That type of thinking, as satisfying as it might feel, doesn't really produce any solutions and unfortunately keeps us stuck in that pattern of helplessness and depression. The second technique is all about embracing change. So I want to ask you, what is your relationship with change? How do you feel about change? Do you like it? Does it make you comfortable or uncomfortable? Are you scared of it? Are you agitated when it happens? And the key here is to try to make friends with change, to recognize that it is inevitable, to try to allow it, and even welcome it into your life. So what are some ways that you can actually welcome change into your life? You can welcome it by simply sprucing up your routine a little bit. So if you sit at a particular seat at your dinner table, go sit in a different seat, or take a different route to work, or try brushing your teeth with your opposite hand, and just kind of see how that feels. At first, it might be a little bit odd or a little bit unnerving, uncomfortable, but after a while, it will become no big deal. So the reason why I'm suggesting some of these smaller change tactics is if you can get used to accepting and embracing change and even welcoming it, then when unanticipated or inevitable changes happen in your life, you will be much more equipped to handle those and much less depressed or sad or fearful when they do in fact happen. The third and final technique I will discuss is resisting the urge to withdraw and cancel plans. So many individuals who struggle with depression also tend to struggle with keeping their plans. They might, feel okay the day they accept an invite, and then the next day they no longer feel like going or being social. So sometimes isolation can be a good thing. It can give us time to recharge our batteries, settle down, but when it's done excessively, it can lead to feelings of loneliness and it can make that depression so much worse. So I would really like to challenge you to stick with your plans. If you agree to go somewhere, go there. If you invited somebody to join you to a sporting event or a concert, make it happen anyway. Resist that urge to cancel and resist all the possible excuses that you probably have in your head. I am tired, I don't feel like it, something came up. If something truly did not come up, just go, just make it happen, and you will maybe even realize that the hardest part was just getting there, and being there was actually fun and enjoyable. Something that you would have missed out on had you isolated and canceled that plan. Just as I suggested in last week's video, I would highly recommend practicing these techniques on a daily basis, and over time they will slowly start to rewire your brain and help you create some healthier habits, and also a healthier relationship with change, with other people, and most importantly, with yourself. Thank you so much for watching part 7 of my 10-part series on depression management. If you found this video to be helpful, please subscribe so YouTube can alert you the next time I post a new video. Thank you for your time and take care.